don't
Priya ji.
understand Hindi. Yeah, I'm actually from Malaysia. I only speak English. Thank you.
Okay. Okay, chalo. So we start here. We start with the second semester syllabus. So we'll start with the cardiovascular system today. So what do you understand by cardiovascular system? What is cardiovascular?
Connected
Heart
with
and blood vessels together.
circulation, blood circulation.
Yes, so actually, like we have here cardio, it says two names, cardio and vascular. So cardio is related to blood, heart, and vascular is related to blood. So it is also known as the circulatory system or a vascular system, right? And of course, the lymphatic system is also there. So it is including everything, the heart, the blood vessel, everything. So here we are going to see the heart now. Now we know that heart acts as a pump. So you must have seen the pump, right? Installed in your buildings, like whoever stays in the building, there is a water tank on the ground, and there is one water tank overhead on the terrace, right? So there is a pump. When you start, all the water from the tank which is on the ground, it goes and the tank overhead, it gets filled, right? This is the normal system. So this pump which is there, that is your heart. So it is just circulating the blood to the whole body. So whatever blood it is getting from the right side of the heart, from the vena cavas, it is supplying, purifying that, it is adding oxygen to it, taking out the carbon dioxide, and it is sending it back to the whole body again. Okay, so heart is just pump, but very important pump, because it is sending all the nutrients to the all body parts, right? So this is something very, very important. And I mean, we all know that if the heart working stops, then it is very difficult for us, right? So one cannot survive. So it is helping us to transport the oxygen, the carbon dioxide, and the nutrients. And who helps the heart? It is the blood vessels. So how is the blood vessels helping it? By supplying the transportation channels, right, for the blood. So that is something really very, very important. Now, when we come to the heart is divided into four parts. We all know it has got the four chambers like this, right? So now if you see, this is the right side, this is the left side. These are the auricles. One moment. This is the upper auricle. The lower one is the ventricle, right? So actually, like if you see now, this right side atrium, it gets all the blood from the whole of the body, from the superior vena cava, SVC, superior vena cava. Okay, and from here auricle, what happens? Here there are some valves in between the auricle and ventricle. All the blood goes to the ventricle. It comes here, and from here, where does the blood go? Blood goes to the lungs, right?
Pulmonary
The lungs,
artery.
yes, through the pulmonary arteries, pulmonary veins, arteries, sorry. So it goes to the lungs. Here it gets oxygenated. And from here, from the lungs, now it comes to the left atrium, right? And from here it comes to the left ventricle. And from here there is the aorta, and it supplies the whole of the body, right? This is the normal functioning. And actually, like when it is going to the lungs, from the right ventricle, here also there are some valves, And when the blood is going from the left ventricle to the whole of the body, there also some valves are there. Okay, so they are the gates like which will open and allow the blood to go. So basically, like if you now see, this is the right atrium and the right ventricle. They work as a unit, right? They are the one is on the ground floor, other one is on the first floor, and similarly on the left side also, right? So atrium and ventricle, they are like a functional unit. But if you now see both the atrium, they also work together. They will contract together and they will relax together. Same way, the ventricles also, they will contract together and they will relax together. Let me see, I'll show you one diagram so you will understand it very nicely. See now, this is your heart. It is in the center. Only thing is the apex is on the left side, and it is in between the fifth intercostal space and the first intercostal space. So here, can you see this now? See, this is the tricuspid valve between the right atrium and the right ventricle. And this is the mitral valve between the left atrium and the left ventricle. And when the blood goes from right ventricle to the lungs via the pulmonary artery, here there are the semilunar valves. And when the through the left ventricle, when the blood goes to the aorta, here also there are the semilunar valves which open when the ventricles contract, right? So now if you see here, so the blood which is traveling through the whole body, it comes to the right atrium by the superior vena cava and leaves the heart via aorta, right? So this is something really very, very important. So this is the rules I told you, that the left and right atrium, they contract and relax simultaneously. Same with the right and left ventricles. And then the right atrium and right ventricle work as a functional unit, right? So there is a harmony in between them. And the left heart will be able to pump as much as blood what the right heart gets from the body. So this is something very, very important function we all should know. Now coming to the cardiac muscle. Now this cardiac muscle, it is the same as the skeletal muscle, but only thing is it is striated, right? So if you see the cardiac muscle now, see, it is like this. Yesterday also, I mean, in the first semester, I showed you, this is the skeletal muscle, these are the smooth muscles, and these are the cardiac special muscles. And if you now see the heart, see how nicely it covers the heart. So if you see the outside one, this is the fibrous pericardium, the parietal pericardium, and there in between there is a cavity where there is the fluid. And then this is the myocardium, that is the muscle. It is the thickest one, the myocardium, right? And then the inside layer is the endocardium. So many times we hear the word endocarditis, pericarditis. So now you can understand where the problem is there. So is it in the muscle? Is it in the inside layer, or is it on the outside layer? So now if you see the muscle again, it has got 75% water and solid elements of 25%. Now, what are the properties of this cardiac muscle? First is the excitability. What does it mean by excitability? So whenever it gets stimulus, it will get excited. That is the excitability. Conductivity is what? Whatever the excitement it has got, it will conduct further. Contractility, it will contract. And rhythmicity, it will work in rhythm. That is it, right? So this is something really very, very important. Once we know that, how does the heart work now? So there is a systolic phase and there is a diastolic phase. Now, what do we understand by systolic and diastolic phase? Sorry, I was showing you the circulation earlier and I forgot that. See, this is the circulation, the pulmonary circulation, right? Where the small circulation, the blood is going to the lungs, and from there it is coming to the right atrium. And the big one, this is the systemic circulation. So from all the body, the blood get collected, and via superior vena cava and inferior vena cava, it goes to the right atrium, and from there to the right ventricle, and then it goes to the lungs. So I was showing you this. See this. Now, how does the heart work? So actually, there is a systolic phase. Now, what does systolic phase mean? Systole means when it contracts. And what is diastole? Diastole means it relaxes. Okay. So always remember that it is contracting and relaxing. Now, if you see the cardiac cycle, it is of how much long time? How much time it takes to complete a cardiac cycle?
8 seconds.
0.8 seconds, not
No,
also 8 seconds,
no,
0.8
0.
seconds,
Hmm.
right? So
Hmm.
now here, I'll just make this picture a little big so that you can understand. Yeah. So now if you see here, see this is the inside one is the atrial atrium. They are representing the atrium. So now if you see the atrium systole, how much it is? The atrial systole, it is only for 0.1 second. See, this is the division. So it is contracting only for 1 second, 0.1 second, and rest of the 7 seconds. If you see, this is the 1. Then 2, 3, 4, 5, 6, 7, 8. That means for 0.7 seconds, it is relaxing. Okay, so it is contracting for 0.1 second and relaxing for 0.7 seconds. And similarly with the this thing, ventricles. Now, if you see this ventricular systole, it is contracting for how long? 1, 2, 3. 0.3 seconds, and then it is relaxing for 1, 2, 3, 4, 5. 5. No, 0.5 seconds.
5
Okay.
seconds.
In this, now if you understand, see, this is the inside circle is the atrial one, and the outside one is the ventricular. So only for 0.1, 2, 3, 4, 0.4 second, this whole part, if you see this one, they are together relaxing. That is, they are in the diastole stage. Okay, both the diastole and both the atrium and the ventricles. Okay, so we have to remember this always. This is clear? What is systole and diastole, right?
Yes.
So we go
Yes.
ahead. Yeah. So here also in the tabular form they have given that, see, 0.1 second this atrium is contracting, and ventricle is contracting for 0.3 seconds, and now on the B1, that is the atrium is relaxing, and the D is the ventricles are relaxing. Right? So now here, what are the rules again? That all the 4 chambers of the heart, 2 atrium and 2 ventricle, do not systole at a time. They will not contract at a time. So we have seen, first atrium will contract, then it will relax, and after it has started relaxing, then the ventricles will contract, and then it will relax. But all the chambers, 2 atrium and 2 ventricles, stay in diastole phase for 0.4 seconds. So that is something very, very important. Now coming to the heart sounds. Now where do we see the heart sound? See here. You can, when the doctor checks you with the stethoscope. So if you see here on the fifth intercostal space here, the tricuspid and the mitral valve, when they close, the first sound is heard there, and the second one is here on the aortic and the pulmonary valves. When they close, the second sound is heard here. So when the doctor checks with the stethoscope, then he comes to know, then he tells you whether you need any more investigation or more treatment is needed or something, right? So this is something very, very important. Now coming to the ECG. Now, what does ECG check? ECG checks the impulse. It is the electrocardiography, right? So the
Yes.
impulse which causes the physical events is an electrical fact. So it can be studied by ECG. So the electrical event happens in various parts, surfaces, and cavities of heart in different time. So all those are noted. So now if you see this electrocardiograph, it is a graph roll which works on spatial parameters. So if you see here, the time record. So there is a square there. I will show you the squares also. So if you see the horizontal line, what it is recording? It is recording the time. Okay. And the vertical line, this one, it is recording the current. So whatever the voltage it is generating, the heart is generating, it is measuring that. Here. These are the waves. The P wave. So this is the PR interval. This is the QT interval. This is the QRS complex. And then it is relaxing. Then it forms the T wave. So when the P wave is there, what is there? The P wave is your atrial systole. Okay. And the QRS complex, that is your ventricular systole. So now if you see here, P wave, see, the wave represents depolarization. Depolarization means the charge is going away, that is, it is contracting. Okay, so that is showing 0.1 millivolt amplitude. Okay, so that is your atricular systole. And then the PR interval, it is telling you the time taken for the conduction of SA node impulse to AV node. And then the QRS complex, this wave represents the depolarization of the ventricular muscle. So this is here, the ventricular systole. And then the ST segment, it indicates the relaxation of the ventricles. And the T wave, it shows that the impulse coming from the SA node after the systole of the atrial and ventricles, when it reaches to the auriculoventricular groove to die out, then the base of the ventricles become excited and form the T wave. So ECG helps us to see if there is any conduction is blocked. Okay, so or whether there is any hypertrophy, that is the muscles of the heart have enlarged, or there is atrial fibrillation, or is there any tachycardia? Tachycardia means high pulse rate or low heart rate, sorry, bradycardia, tachycardia. So it is for that purpose. Now if you see that the function of the cardiac cycle, it is regulated by nervous regulation. The vagus and the cranial nerve plays an important role, and similarly there is endocrine regulation. So hormones secreted by the adrenal medulla, that is the epinephrine and norepinephrine, they act on the heart muscles. So we know that endocrine, epinephrine and norepinephrine from adrenal gland, what they do, they help you to fight and flight, right? Means what? The heart, it starts supplying more blood to your upper extremity and lower extremity, so that you can fight or you can run away from there, right? And what about the nervous regulation? Now this nervous regulation, I'll show you the, see here, the picture, it is something really nice. This one. See now, here the SA node, it is being generated at the right atrium. So this is the nerve impulse. Then what will happen? This nerve impulse, the SA node, what we saw, the P1, it will go from here to the in between wall, interseptal wall. Here, this is the AV node, atrioventricular node. And from here, now see from the mid-septum how it is going. You can see this is the right bundle branch, this is the left bundle branch. And then it is coming here, taking a U shape, and then it is supplying the whole of the heart on the outer side. And when it comes here, this is known as the Purkinje fibers. So this is how the nervous regulation is taking place. So that is about the how the function of the heart takes place. Now coming to the pulse. Now the quantity of blood pumped out of the aorta forcefully by the left ventricular systole. It is coming out, right? So it will come out because it is pushing it for so long, 0.5 4 seconds, right? So what will happen? The blood will travel through the blood vessel, and when it will travel through the blood vessel, it will go and what to say, bump on the walls of the vessel, so that it will create a vibration wave along the walls of the blood vessels, right? So the speed of the vibrating wave is higher than the speed of the blood, and this wave gives the message to the peripheral cells and tissues about the reaching of the blood. And this speed of the vibration is 4 meter per second in aorta, 8 meter per second in the greatest artery, and in small arteries it is 16 meter per second. So the pulse is felt just after 0.1 second after the heartbeat. So once the heart has contracted here, you get the heartbeat. After 0.1 second, you will get the pulse on your various areas. Now where the pulse is seen, it is generally seen on the bones just below the skin, where the arteries are directly placed, right? So there can be the radial pulse, there can be the femoral pulse, or the mid-inguinal pulse. See here, at various places you can feel the pulses. So actually when you take the blood pressure, you can see feel the pulse here at the brachial artery, right? Here on the neck it is the carotid artery, then on the inguinal region it is the femoral, then behind the knee it is popliteal, in front of the ankle it is dorsalis pedis, and below the internal malleolus it is posterior tibial. So all these are felt everywhere. Now again these are in the wave form. So actually now if you see here, you can see the pulse rate. Now how much it is? 72 plus minus 5. It can be plus minus 10 also many times. In females it is little more. So if the pulse rate is higher, it is known as the tachycardia. So actually, like if you keep your three fingers on the on your left hand like this, you will come to know, you can feel the pulse, right? So there is that styloid process, on that you can feel it very nicely. So if the pulse rate is less than the heartbeat, it is known as the pulse deficit. Okay. And then if it is high, it is tachycardia. So it can be in many emotional conditions, or climbing up the stairs, or in some diseases also, like high fever, atrial flutter, and toxic adenoma. And the bradycardia, this is because of the depression, or also in the trained athletes, right? So it can be also because of the diseases like meningitis or cerebral abscesses, where the intracranial pressure increases, right? So this is about the pulse rate. Then the rhythm of the pulse rate. So if you see, the pulse rate can be felt at an interval of 0.8 seconds regularly, and it is known as the regular rhythm. So rhythm is what? It is coming at a regular pace, right? So that is the rhythm. So in atrial flutter and fibrillation, pulse persistently becomes irregular, right? So there can be also an extrasystole, the premature beat, means before the time the pulse is coming. Then next one comes the character or the form. Now what is the character or the form? When the volume per pulse, it remains equal and full, it is acknowledged as its character. So if you all place your fingers on the wrist, you can feel it. So somebody might feel it thin, somebody might feel it coming with a big gush, like, so that is the volume. Whether it is coming up fully or it is not coming up fully, that is the character of form. So it can be thin, thready pulse because of the vasoconstriction, right? Or it can be full bounding pulse. When the cardiac output, it increases because of the vasodilation of the peripheral arteriole. Or there can be a plateau pulse. Plateau pulse means what? It will come and it will halt at the summit, at the top. So that will be plateau pulse. Or collapsing pulse or water hammer means what? It will come and it will just fall down. Come and just fall down. So it is of various types. Yes, Manish ji, you want to ask something? You've raised
Yes,
your hand.
ma'am. Yes, ma'am.
Yeah, yeah.
So, ma'am, my question is, pulse rate and heart rate same thing or different?
No, that's what, like, the heartbeat. We saw that way after the heart beats, after 0.1 second, the pulse comes. So it
Okay.
will be felt at various places. So the pulse, you can feel it at various, as I showed you the picture right now, in the inguinal region, in the
Hmm.
popliteal fossa, you will feel the pulse over there. So pulse is basically the vibration. Vibration wave means what? Whatever the blood is coming and it is it is hitting the wall of the blood vessel. That is the
Hmm.
pulse. And the
Hmm.
heartbeat, what we saw, heartbeat was the opening and closing of the valves.
Okay. Heartbeat is the opening and closing of the valve. Okay.
Yes, yes. So that is when that is the sound they are making. That time you get the heart sounds. And sorry, I just got mixed. No, it is heart rate is like the same thing. We'll come to that when we read the cardiac output. No, that time we'll come to that. But they are two different things. The heart rate and the pulse rate, they are the two different things. If you see function structurally, the heart rate is in the heart and pulse is at the various places. So if the blood vessel, if the blood supplies properly or not to the whole body, it can be known through the pulse rate. Okay, so there the heart rate will not come to help. Heart rate may be normal, but if there is some blockage in between, the pulse rate will be different. I think you got the answer now, Manish ji.
Yes, ma'am. Yes, ma'am. Thank you.
Yeah.
So, ma'am, can we consider it as pulse is the speed or the rate at which the blood is being supplied to different parts of the body?
Yes, we can. That's why I said no, that whenever I mean, if somebody has problems, so what you can do at both the inguinal regions or both the popliteal fossa, you can check whether you can feel the pulse properly or not. So many times even they check the pressure out there also. So it is just like to know whether there is any blockage in the in between or not. So that is how for that purpose we check the pulse. Then coming to the volume. Now volume of the blood is the blood shared in cardiac output to each extremity. So one should compare by assessing the radial, femoral and carotid pulse. So physiologically, if you see, both the extremities will have volume normal and equal. But in inspiratory phase, when you take an inspiration, the volume normally increases, and when you exhale, then the volume reduces. So the patient is suggested to take slow, deep breaths when the pulse volume you are testing. Now, what is pulse paradoxes? when pulse volume increases in expiratory phase. Otherwise, it is supposed to be low in the expiratory phase. So this is pulse paradoxes. So it can be because of the pure thoracic breathing. So actually we are supposed to do breathing from thorax as well as the abdomen, right? So or there can be even the pericardial effusion. Then pulses alternance. When one pulse volume is normal and the other is abnormal. So it can be in defective myocardium. So if there are any myocardial diseases, then you can see on the right and left side, they can be different. Then condition of the arterial wall. Generally, the artery is found soft flexible when it is felt on the related bone by rolling the fingertips. But in case of the arteriosclerosis, the arteries will be hard and rigid. So actually, if you lightly tap your artery on the elbow, you will come to see. When you tap them, they will lightly come up. Softly, they will come up. So you can come to know whether there is arteriosclerosis there or not. Otherwise, you can feel it taut, very tight one, you can feel it that way. So in cases of polyarteritis nodosa, the walls of the arteries may have small granules. So there can be some thickening. So you can feel there. Now, coming to the cardiac output, it is the efficiency of the heart muscles, in short, in terms of blood volume. So, now what is the cardiac output? It is the volume of blood per minute pumped by the left right ventricle to the aorta. So, now if you see here, see this is the stroke volume. Stroke volume means what? When the heart is pumping at one pump, how much ml of blood it is sending? 70 ml. And how much is the heart rate? Heart rate, suppose it is 70 per minute. It is beating 70 times per minute. That means the cardiac output is 70 multiplied by 70, that is 4900 ml. Means almost 5 liters of blood per minute the heart is pumping out. Okay, so this is your cardiac output. Now this stroke volume, it depends upon the muscles of the heart. So if the muscles are strong, it can, maybe this is 70 ml, it can generate 80 ml of blood also. So in that case, it will supply more blood to the whole body per minute, right? So the length, stretching of the heart muscles, it is directly proportional to its force of contraction. So always you are supposed to know how is the quality of the heart muscles, whether they are strong or not. So otherwise, if you see some people, when they climb the stairs, they start feeling tired. So it means that there can be some problem with the heart. So you have to check why that problem is there. So so that you can come to know whether the cardiac output of the patient is normal or not. Then coming to the arterial blood pressure. Now this is the pressure of flowing blood extended on the lateral walls of the artery. As we saw earlier, that the blood which is hitting the walls of the blood vessels. So this is the blood pressure. So now how this is calculated? It is calculated by cardiac output multiplied by the peripheral resistance. Now peripheral resistance means what? The resistance applied by the walls. So the walls of the blood vessels, they are elastic, right? So are the walls of the blood vessels in good elastic, they are having good elasticity, there is good viscosity to the blood, and also the gravitational force, so accordingly the peripheral resistance will be there. So left ventricle, they pump the blood forcefully into the aorta in the systolic phase, and then the aorta has elastic fibers which help it to accumulate the blood, and then it will send it further. Now if you see here, the aorta, it works on the physics principles, the kinetic energy and the potential energy. So what is kinetic energy? It will start to flow. So like once it gets that motion, it will start flowing, and the potential energy is the stored energy. So how much ever it is the elasticity of the aorta and the blood
Blood
vessels, it will
vessels.
start flowing properly. So the cardiac cycle, the two pressure works. One is the systolic pressure and another one is the diastolic pressure,
Understood.
right? So if you see here, the systolic pressure is 120 plus minus 10 mm and diastolic is 80 plus minus. So if it is more than 90 mm, the diastolic one, it is hypertension. If it is less than 70 mm, it is hypotension. So here they have given a nice chart. You can just go through and understand on what the peripheral resistance and the heart rate is dependent, and the stroke volume also, right? So if you are in the lying down or if you are exercising, the stroke volume will increase, and if you are lying down, it will decrease, or even in case of the temperature also the same thing will happen. And then we saw this, the circulation, the pulmonary blood circulation, that is the small circulation and the big circulation, we saw that. Then after that we come to the exchange of nutrients and gases at the capillary bed. So now if you see the arteries, this is a big artery. What it will do, it will divide and redivide. Again, it will divide and redivide, right? And when it divides and redivides, what it is doing, it is forming the capillaries, right? So if you see here, these are the ones, the capillary. It is made up of endothelium, single layer flat cells, and it will exchange what, all the nutrients, ions and water through the capillary to enter into the extracellular fluid, and excretory products and secretory products of cells which are present in the intracellular fluid enter into the capillary fluid through the ECF, right? So this is your capillary bed. And then what is the heart attack? What is it? What is a heart attack?
When heart is not able to get the blood for himself and there's a blockage in the arteries between
Yes.
and
So
of the
Stops brain the pumping.
yes. Actually, now if you see, the heart gets its blood supply through the coronary arteries. Now, what is the point for coronary arteries?
Coronary arteries gives oxygen to
The
heart.
heart. Yes. So, do you know any TCM point for that? Are you taught that?
Mm.
No, it will come in next this thing. I think Dr. Wohl's nice point is there for the coronary artery, so definitely will get. But if there is a heart attack, definitely you can prick on H9.
Put on H9 and
Yes,
leave to a few drops of blood.
yes, yes. So that will definitely help to subside the heart attack, and you can take the patient to the hospital very well.
Hospital.
So what are the conditions patient will show? He can show perspiration, sudden weakness. There can be pulse of low volume, low rhythm. Then there can be pain on the left arm. There can be pain on the left side of the back.
Left
So
back,
maybe the
left
pain,
arm,
yes,
left
and
arm.
pain can be referred to the jaw also. So that is also a
Yes,
sign
yes.
of the heart attack,
Mm. She will not
right?
be able to talk,
Yes.
can't move the tongue.
ma'am, ma'am,
Yeah.
if pain is in this clavicle bones also in this
Mhm.
area, that is also related to heart.
Uh, Actually, you have to see all the other symptoms also.
It can be related to lungs also.
It can be related to lungs, but I would always
Yeah.
advise, like, first you check with the vitamin D3, because like if the bones are weak, then also, the pain can come there. So you have to check whether the one is not osteoporotic. So vitamin D3 and blood calcium has to be in good this thing, good range.
Actually, just before a month, my father expired and he was having pain over there.
Mm-hmm.
That's why I was asking you.
Acha. No, it can be a referring pain, but generally now what patients I have seen, it goes to the jaw. or it goes to the left arm, it goes on the back side of the on the back, on the scapula. So I mean, like, but it can be, like, it is not that it cannot be, it can be. So you have to rule out the causes why the pain is there.
Asthma patients also having back pain.
Yes. No, so
Yeah.
that's what, like, so
Yes.
I mean, like, you keep twisting the little finger. So if the pain subsides, that means it can be of the heart also. So many
Yes.
times you can
Yes.
check it that way also, because it is directly related to the little finger, no, heart meridian.
Yes. Yeah.
So with that, we come to the respiratory system. Now, what do you understand by respiratory system?
Functioning of lungs
Functioning
in the
of the lungs.
inspiration and expiration.
Okay. Taking in oxygen and exhaling carbon dioxide.
Carbon dioxide and water.
Right? Now, if you see this respiratory system, I'll show you a picture. See here. This is the whole respiratory system, right? Now, here there are two parts, the upper respiratory tract and the lower respiratory tract. So, where is the upper respiratory tract?
Nasal cavity, pharynx, larynx, etc.
Show me on your yourself where it will come.
It's the upper part. That is nasal cavity, larynx,
Yeah. So actually, you
pharynx.
just keep your hand here, like on the neck. When you keep
Yeah.
above the hand, everything is the
Yeah.
upper respiratory tract, and below the hand, it is
Yes.
everything is lower respiratory tract.
So,
So when the infection is in the upper respiratory tract, it is very easily it can be
curable.
treated, right?
Ma'am,
Otherwise, then it.
can we
Hmm?
say that above the voice box it is the upper
Yes,
respiratory okay,
yes,
okay.
yes.
Can be.
So here now, if you see, actually, this is the nasal cavity. Behind it is the nasopharynx. Then this is the oral cavity. Behind it is the oropharynx. Below it is the hypopharynx, and then here it is the larynx. So from the here the trachea is starting. So actually now if you see in this picture here. So basically when you keep hand on your neck like this, and if you try to say a word, you can feel vibration out there. That is the larynx, your voice box. So you can very easily divide that. So now if you see the path from the nasal cavity to trachea, it is the path of the air to come in and go out, right? So what does it do? Basically, it conditions the temperature of incoming air, your nasal cavity. There are the hair. So what it will do, it will moisten, it will humidify the air, and according to the body, maintain the airflow speed, make it dust free, and also it will control the humidity. And larynx is at the midway, which is the speech box, and also it is the watchdog for the trachea. So it will generate a cough reflex if any particle of food or water move towards the trachea, and that is why there is a epiglottis. So always, like, when you are chewing food, it will close the windpipe, right? So actually
Yes.
that's why our parents always tell us that while
Don't
eating,
talk
do
while
not
eating.
speak. Yes. So that is something really very, very important. And the walls of the trachea, bronchi and bronchioles are made up of smooth muscles and the semi-cartilaginous rings, and this structure helps not to being collapsed. So now if you see here again, this picture, actually this picture is not really very clear, but yeah, here if you see, this is trachea and this is made up of the semi-lunar
Rings.
rings, right?
Rings.
So why are these semi-lunar lunar rings? So that it doesn't collapse.
Yes.
Esophagus, it can become like a soft pipe, right?
Flexible. It is
Yeah, it
flexible.
is flexible, right? And then this on the back side, it has little curve shape, this trachea, so that it can accommodate the esophagus when the food is
Esophagus.
inside it, right?
Yeah.
So
Yeah.
that is why it is this shape,
Semi-circular.
semicircular. So now if you see, the structural and functional unit of lungs is alveolus, right? We had last time we have talked that it is pleura. When we say pleura, that is also lungs, but alveolus, that is the structural and functional unit of the lungs. So
Of
through it,
lungs.
it takes in oxygen and gives out the carbon dioxide. And there is a balloon type structure which is made up of single flat cell epithelium at the end of each alveolus and alveolar ducts. And these balloons can become bigger when the air pumps in, and then becomes flat when the air is not there in it, right? So actually, what it has got, the alveolar epithelium, it has got two types of cell, type 1 and type 2. So if you see these type 1 cells, they are flat cells with the cytoplasm, of which it has big nucleus and cytoplasmic fibers. And the type 2, they are the less in numbers and also known as the pneumocyte. They don't take part in the exchange of gases. The type 2 cells, they are not taking part in the exchange of gases, and they release a special type of surfactant which do not allow the alveoli to collapse. So if you see the picture of this alveoli here, see this one.
Mm.
This is a
Mm.
picture of alveoli. Here you can see this type 2 cells. These are the type 1 cells, right, which has got nucleus. And this is a type 2 cells. It is forming that special liquid, the surfactant, which will not allow the alveoli to collapse. It will keep it always
Open.
open. And see, you can see here, this alveolus, it is exchanging the oxygen
Gases.
and carbon dioxide with the
Outside.
capillaries.
Mm.
And it is believed that each alveolus, it is connected to the other alveoli present around through the windows. That is
Mm.
why when you inhale the air, it can distribute easily through these vents. Okay, so it is not that you have to breathe into each alveoli. So each alveoli, they will help to disperse the oxygen or carbon dioxide. Then coming to the functions of lungs, first one is the respiration, right? So what is the difference between respiration and breathing?
Exchange of gases is
Actually,
respiration and taking the air inside, so that is breathing.
Right, very correctly. So whatever is happening in each cell, that is respiration. The exchange of oxygen and carbon
that-
dioxide in each cell, it is
and utilizing the oxygen for
the utilizing the
burning
oxygen,
glucose.
the cell is doing that part.
That is
Yeah.
actually internal respiration.
Yes, yes. So now how the exchange of gases is taking place? It is taking place by diffusion method. And then
Yes.
there are some non-respiratory functions. So it helps to maintain the pH of blood. How it will may help to maintain the pH of blood?
By absorbing oxygen and removing carbon dioxide.
So what happens if the carbon dioxide is inside?
Carbon dioxide is acidic.
Carbon dioxide is acidic, or it will
So
form
by removing carbon dioxide, it will be
yes, it will make carbonic acid. The carbon
uh,
dioxide, if it remains inside, it will make
yes,
carbonic acid,
become carbonic
and
acid.
so the pH of the blood, it will
Right. It will reduce.
decrease. So it will become
Reduce.
acidic. And then it will regulate the temperature of the blood. Then it will
Yes.
regulate the quantity of water in the body, and it will help in the excretion of alcohol and acetone also.
Exactly.
Then it will help in secretion of surfactant, and this is the surfactant which we spoke about. So when the baby is delivered, when it takes the first cry, what happens? The air enters inside the alveoli, and because of that,
Forcefully.
if forcefully, yes. So what will happen? The alveoli, it will expand, and that is why the baby cries, because it hurts him a lot, right?
Yes.
So if the baby doesn't cry, what is happening? The oxygen is not going inside, and baby is not able to make its own
Breathe.
food, because oxygen is needed, right? So if the surfactant is not there, the alveoli will remain collapsed, and the exchange of gases will not take place in the baby. And because of that, the baby is not
Baby may
responding, and
die.
it will die. So there will be respiratory distress. So that is known as the respiratory distress syndrome, or the hyaline membrane disease. Then lungs also helps in fibrinolytic activity. That means if any thrombus it goes into the lungs, it will dissolve that. So the lung makes those special enzymes. And then it has the secretion of converting enzyme, which transfer angiotensin 1 into angiotensin 2. We'll study this angiotensin and angiotensinogen in the kidney chapter. So this secretion of the hormones of the prostaglandin also. Now these prostaglandins, they are also something very, very important, right? So they will help,
Dilator.
yeah,
It's
they
a bronchodilator.
bronchodilators. They will help the bronchus to dilate,
Bronchus to
right?
expand.
So they are something very, very important. Now coming to the respiratory mechanics. Now if we see the respiratory mechanics, the respiration is taking place with the thoracic cage, muscles, pleura, and the lung alveoli. So actually,
Yes.
if somebody has got any operative surgeries, of the heart or lungs, you should just ask the patient to do hand exercises, the PT exercises, what we do. So what is happening? The thoracic cage is moving. Along with the thoracic cage, the muscles, they are also moving, and because of that, the lungs are able to expand nicely. So definitely it helps a lot. Then this is about the pleural membrane. So we have seen that the pleural membrane, we didn't see. I'll show you the picture here. See, this is the pleura. So lung has this pleural
Membrane.
lining, and in between there is the liquid.
Fluid.
So the liquid is there
Fluid.
so that there is no friction because
Yes.
of that. Otherwise, while each time while taking the breath, the friction would have taken place, and the one would feel pain. So to avoid that, the God has made a nice
Lubricating
pleural.
oil.
Yes.
Just like
Then coming to the types of breathing. And here, this is something important. One respiration cycle, it takes place for 4 seconds. Okay.
seconds.
So this is something very important. So generally, if you see 14 to 18 times per minute, we breathe. So, and the gaseous exchange, it takes place in between 1.2 seconds. So only in 1 second. So inspiratory phases of 1.2 second, and the gaseous exchange is taking place only in 1 second. So that is something really very, very important. Now coming to the types of breathing. When we do normal breathing, that is known as the eupnea. When the rate of respiration, the rate and the depth of respiration both are higher than the normal, that is because of the hyperapnea. So it can be because of the heat, intense pain or emotion. And tachypnea is when the rate of respiration is higher but the depth of the respiration is normal. So it will happen when the body temperature is high due to fast running. So that time there can be tachypnea. So there is a difference between hyperapnea and tachypnea. Then there is apnea. So there is an interval of 10 seconds between the inspiratory and expiratory phase. That is the apnea. There is no breathing, cessation of breathing is there. So no movement of muscles on inhalation. Then chain stroke breathing. It is an abnormal pattern of breathing. So there will be sometimes deeper, sometimes faster breathing, and by a gradual decrease that results in temporary stop in breathing. So it will be fast and no breathing at all in between, that kind of a thing. Then coming to the breathing sounds. Now these breath sounds are the noises produced by the structure of the lungs during the breathing. So, if you see here, the noise at the trachea, which we may hear with a stethoscope, is known as the bronchial or tubular sound. So, whenever you feel, if you put a stethoscope here, you will feel the bronchial sound. And the sound at the chest, here in front or at the back of the lungs, it is an indication of open bronchi or ruptured bronchi or lung parenchyma, it is atrophied. So when there is a vesicular sound, it is rustling quality of inspiration. Okay, and softer during expiration. So generally, like if you see here, it is because of the air filling in the alveolus through a tube. So you can see the vesicular breath sounds. So they will be very soft one. Then the rhonchi, they are continuous low pitched and there will be rattling. So grrr, you can feel like a snoring type of a thing. So obstruction or secretions in larger airways are frequent causes of rhonchi. So there can be some blockages in between there. And there can be also chronic obstructive pulmonary disease. So if there is any obstruction in between. Then crepitations means what? It will be noise like walking on the dry leaves. So it will be constantly, you can feel that crackling noises. So this generates when the lumen of the alveoli is filled with the fluid. So in pneumonia cases or in the tuberculosis cases. Then coming to the tidal volume. So generally now when you and me are sitting, we are breathing in. That is the normal breathing. That is the tidal volume. And when we breathing deeply and exhale out deeply, that is the vital capacity. Then coming to the bronchial asthma, it is the bronchial muscles develop tendency to go under the spasm. I'll show you a picture. This is the bronchial tree out here. Yeah. See, this is in case of asthma, this is the normal one, and here it is swollen. So, in asthma case, it is swollen. So, that is the bronchial asthma. Then coming to the emphysema. Now, see here, because of the smoke, the walls they have just melted away, and it has become a solid structure, right? The alveoli. So this is the emphysema. And bronchitis is like commonly it is the inflammatory condition, okay, of the bronchi. So it can be also of rhinitis, that is the inflammation in the nose, or sinusitis, that is the various sinuses which are inflamed. Then coming to the regulation of respiration. Now from where it is regulated, the respiration, it is regulated from pons and medulla, right? So now what is in the located in the pons? It is the rate of respiration, okay? Rate of respiration. That center is located in the pons. And which center is located in the medulla? It is the expiration and inspiration. Okay.
Yes.
So it will tell you, okay, that you have to now expire, or you exhale, or you have to inhale. That will be that your medulla will tell you, and the pons will tell you how much rate of respiration has to be done. Whether it is 15 times per minute, or whether it is 20 times, or when to stop. So pneumotaxic center, what it will do? It will inhibit. It will say stop the breathing now. And apneustic center, it will say, okay, now you're supposed to inspire. Okay, so that is the pons and medulla. Very, very important, because like if you cannot treat the lungs, you should definitely treat it on the pons and medulla. Where you can treat this pons and medulla?
On the finger.
Which
Mm,
finger?
mm, I have to see. Once I think left ring finger
Left
with
ring
the
finger.
body.
You should have that chart in front of you always, okay?
Yes, yes, ma'am.
Yeah.
How many? How many we can
Just make two charts, one TCM, one Ayurvedic acupressure.
Yes,
Definitely.
Ayurveda is needed
Yeah.
for
Then
this.
coming to the breaking point. Now, voluntary respiration can be stopped at any phase for some time. But the time will come when the person will be forced to inspire or expire. This is known as the breaking point.
Mm,
Okay, so this is something very, very important, because here the carbon dioxide, it is playing an important role in the breathing. Okay, so it will tell, okay, now it will stimulate the medullary center. It will say, go to the medullary center. Just now we saw, no, the inspiratory center. Now start inhaling the air. So that is why carbon dioxide is something really very, very important. Now, this carbon dioxide, it is needed in the body definitely, because all the cells are making energy and they are releasing the carbon dioxide. But if there is lots of carbon dioxide, then also it will give trouble. Okay, so the rate of respiration will increase if the air has 1.5 percentage of carbon dioxide, but the person will not notice, but his rate of respiration will increase. And when the person will start noticing, when it goes to 4%, okay, that time the person will start noticing it. And if it is 10%, the patient will have pain in breathing. Okay, this will be dyspnea. And at 15%, it will, the muscles will all become rigid. They will start having spasms like this, and the patient can have tetanus like condition, or patient might just shake. So this is the toxicity of the carbon dioxide. It is reached to 15% in the body. And the cellular necrosis, it will start at the 20% of carbon dioxide in air. For 10 to 15 minutes, if it is there, the patient will start feeling drowsy, mucous membrane will become bluish in color, and if not treated, within 5 minutes, the patient can die. Similarly, the toxicity of oxygen also. So the normal value, how much it is? 19 to 20% in the atmospheric air. But if it
mm,
increases up to 30%, the patient will feel energetic. Wow, very nice. But if it becomes more than that, so the patient will become, the person will become restless. Why? Because now there will be nasal congestion and burning will start, more oxidation, okay, after 12 hours. And he will be unable to find out what is wrong happening. And in next 24 hours, symptoms of pneumonia will appear, and possibility of cerebral ischemia will also increase, right? So that is about the toxicity of the oxygen.
oxygen.
So now if you see here how much you need, so you need oxygen 20.95 ml, carbon dioxide 0.04%, then nitrogen is 79.01, and water vapor is 5%. Right, so nitrogen, now it is something important. It doesn't take part in the respiration, but it is partially soluble in water, and it does not diffuse in through the respiratory membrane. But now if you see here, the transport of gases, they depend upon the two qualities. If they're water soluble, because of that, and there should be some carrier for its transportation in blood. So we know that oxygen is soluble in water, and it is transported in the blood by hemoglobin, right? So that is how
Yes.
the transportation takes place. Now, what is hypoxia? When the tissues receive the inadequate volume of oxygen, then what they normally require is known as hypoxia, right? So there is less oxygen available. So if it is hypoxia means what? The oxygen is less in the air only. So because of that, it is hypoxia, right? So it can be at the high altitude. So generally, like, people have trouble when they go to the high altitude. So they carry the oxygen cylinders with them. Then there can be anemic hypoxia. You have anemia. There is less number of erythrocytes or hemoglobin because of malnutrition or hemorrhage or carbon monoxide poisoning. That is anemic. Then stagnant, when the flow of the blood is very low or stagnant. So heart is unable to pump out the blood if there is any clot or thrombus or in the pulmonary vessels. That is the stagnant. Then coming to histotoxic. Now histotoxic, it is generally, tissues. When we say histopathology, we say it is like the testing of the tissues. So histotoxic is, it is toxic to the tissues. So if the cells of the body are unable to use oxygen of blood due to poison, example like cyanide poisoning, then it is known as the histotoxic hypoxia. So the temperature decreased by 1 degree centigrade at height of every 500 feet above the sea level, and the pressure decreases by 26 mm at the height of every 1000 feet. So because of that, you can get hypoxia, which is a good point of oxygen in your body. Where is it?
LU5,
LU4, LU4,
LU4.
LU4. Yes, it is
LU4.
LU4. LU3 also helps. So LU3, LU4, both of them. So if you keep pressing, so it is the point where you just touch your
The
arm to the
nose.
nose.
Hmm.
That is the point. So you should definitely massage it
It is
regularly.
it is called oxygen point.
Yes, it is known as the oxygen point. Then effects of hypoxia on the nervous system. What will happen if hypoxia is very fast? It is rapid. So what will happen? There can be sudden consciousness, and patient will be knocked down by a blow. And if it is gradual, slowly the oxygen is reducing of the atmosphere, then it can be the symptoms like of alcohol intoxication. There can be depression, loss of self-control. There can be auditory and visual impairment, and he cannot take any safety measures. And on the respiratory system, what can happen? If the rapid hypoxia, there will be hyperapnea. So you will breathe fast, and then there will be apnea, and then may lead to the respiratory failure. And gradual effect will be the breathing rate increases so as to maintain the pulmonary ventilation. And on the cardiovascular system, the heart rate will increase, the force of contraction will increase, and the cardiac output will increase. And the BP will increase, and it will increase the blood flow rate in the coronary and cerebral. And it will decrease the blood flow rate to the splanchnic, that is all your visceral organs, and cutaneous, the small nerves supplying to the skin. It will reduce the blood flow, and there can be cyanosis. And on the GIT, if there is hypoxia, there can be loss of appetite. So actually, you should always pay attention to the old people, whether they are having loss of appetite. So because of many times, dehydration also, what happens? The small capillaries, they close, and because of that also there is hypoxia. So the blood is not reaching there. So there can be nausea, there can be dryness of mouth, and expansion of gas at the high altitude. So this is the effect of hypoxia. So with that, we have finished revising 2 chapters today. Tomorrow we'll do the next 2 chapters. Okay.
Excuse.
So you have any questions today, you can definitely ask.
Okay.
Okay.
Thank you.
Thank you very much, madam.
Thank you.
Yes, sir.
second syllabus is not that easy as for a common man to read the book and understand, especially the ECG part.
Right.
You explained well, and somebody has messaged me that only that ECG part they are finding it little difficult to understand. If time permits, we'll again,
We'll
we'll
revise.
give
No,
explanation.
actually, sir, it is difficult, definitely. So that's why I wanted them to understand the terms, that P wave, QRS complex, and the ST segment. So once they understand the terms, then they can understand the ECG very well. But otherwise, for doctors also, it is difficult, the
Yeah,
ECG
I know
part.
it's not. I mean, it's hard to digest because
Right.
The classes
and,
also were
but you have
late.
made it quite easy, madam, really.
It is
And
difficult.
friends, on the same Zoom link tomorrow morning, 11 o'clock, we have TCM.
CM.
And for second semester, anybody, all of you are kindly welcome. And tomorrow, 8:30, on the same Zoom link, BHP class will continue.
Yes. Yes, sir.
6:30 in a different Zoom link, Krishnamurti sir's TCM first semester class, 20, it's a designed for 20 days, elaborate class. Krishnamurti's class on a different Zoom link at 6:30. And as I told earlier, from this Sunday onwards, Ayurvedic acupressure by Parul Agrawal ji will commence Sunday 7:30 to 8:30 and Monday onwards 12 to 1. Parul Agrawal ji will take for first, second, third, fourth semester. In other words, the entire concept of Ayurvedic acupressure will be dealt directly from her. It is like straight from the horse's mouth because she is a co-author of all the books. So with this, I once again thank our beloved faculty, Dr. Nilima Patil ji, and good night to every one of you. We'll catch up
Thank you,
tomorrow.
sir.
Thank you.
Yes, sir.
Good night, sir.
Good night.
Thanks, sir, for arranging so many productive classes for us. Thank you, ma'am, for teaching us so precisely everything so that we can understand so quickly all these things.
Thank you so much.
Thank you, ma'am. Thank you.
Thank you,
Good night.
ma'am. It was nice.
Thank you, ma'am.
Thank you. Thank you.